Welcome to the Maternity Mentor. Today we will be talking about taboo subjects related to pregnancy and breastfeeding. Stay with us. Hi, I'm Samantha. I'm a nurse practitioner and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Being pregnant and having a baby changes our bodies in ways we don't expect and no one tells us about. Also, there are questions that so many people have and never ask because the subject is taboo. Let's explore some of these never talked about things so you can get some answers. Did I just have an orgasm while I was breastfeeding? The answer is possibly. 33 to 50% of women describe breastfeeding as erotic. This highlights that this can be a very normal sensation and is not something to feel ashamed of. It doesn't mean you have sexual feelings towards your baby, and instead is a reaction to normal body processes. One of the main hormones associated with breastfeeding is oxytocin. Oxytocin, also called the love hormone, is the milk ejection hormone in our body. It helps your breast milk flow out of the breast and to your baby when you breastfeed. Oxytocin is also the hormone that assists us with having an orgasm. It does this by causing strong uterine contractions, which also occur during breastfeeding. Recent studies have shown that rises in oxytocin boost sexual desire and can even decrease impotence in men. Additionally, nipple stimulation, including sucking and breast touch, can increase erotic sensations and occurs both in foreplay and breastfeeding. This stimulation raises the chances that breastfeeding can cause an orgasm. Did you know that your vagina can turn blue during pregnancy? That is correct, blue. Blue vagina is also known as Chadwick's sign. It is caused by increased blood flow to the vaginal region as well as increased estrogen, which can darken skin. Chadwick's sign does not cause any pain, so some women may not even realize that this has happened. Blue vagina can start as early as 4 weeks of pregnancy, making it one of the earliest possible signs indicating a pregnancy has occurred. This bluish color can also occur internally on the cervix. It is more common in women who have varicose veins or who are pregnant with multiples. The good news is that blue vagina is harmless to both you and your baby. Also, your skin should go back to its normal color after delivery. As a lactation consultant, I have been asked this question a lot. Can my partner drink my breast milk? Yes, your partner can. Breast milk is used across the world for more than just feeding our babies. It is also used as a part of many health remedies and is currently being researched for use as treatment of multiple diseases and illnesses. The biggest thing to consider when allowing your partner to breastfeed is whether your baby is currently successfully breastfeeding. Successful breastfeeding is usually measured by maternal satisfaction as well as appropriate growth and weight gain in the baby. As long as your baby is doing well and you make sure to always prioritize feeding your baby first, you are free to allow your partner to breastfeed. Partners may want to breastfeed for a variety of reasons. First, they may just be curious about the taste of your breast milk. They also may want to feel closer to you and more included, and breastfeeding can accomplish this. Finally, breastfeeding can be a part of sexual fantasies for some people, and it is more common than you think. Whatever the reason, as long as you are comfortable and your baby is doing well, feel free to let your partner enjoy your milk. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now, let's talk about sex drive changes. Pregnancy can change your sex drive in a big way. We always hear about lack of sex drive in women during pregnancy, but did you know the opposite can be true? During pregnancy, your blood volume increases by as much as 50% to help support you and your growing baby. As a result, extra blood settles everywhere in the body, including the vaginal region. This extra blood volume causes swelling and sensitivity. Blood is not the only thing that is increased. Many of your hormone levels are also increased. Oxytocin, estrogen, and progesterone are all raised to help support your pregnancy. These increases can stimulate your interest or arousal in sex and can also help you have a bigger orgasm. So, if you are one of the lucky women to experience this, lay back and enjoy. Can your baby feel it when you have an orgasm? Yes, they can. Your uterus is a large muscular organ that contracts during an orgasm. To your baby, these contractions feel like a soothing massage. It is not intrusive and does not bother your baby. In fact, it can actually wake your baby up. During sex, blood flow increases to the entire region, including the uterus. After your orgasm, this increased circulation can cause your baby to start moving around more. As your pregnancy progresses and your baby gets bigger, your orgasms may become slightly weaker. This is because the uterus is unable to contract down as much due to the baby's size. After delivery, your uterus will shrink back down to pre-pregnancy size and things will start to get back to normal. We often hear about hair loss after pregnancy, but have you heard about hair growth? During pregnancy, it is very common to experience increased hair growth all over your body. This is usually caused by the sudden increase in estrogen. You are able to grow hair not only on your head, but on other areas of your body, including your back, glutes, neck, chest, arms, shoulders, and even your face. These hairs will come in darker and coarser. The good news is that the extra body hair usually goes away after birth. However, if you want to remove the hair, you can. Just stick to at-home hair removal techniques like shaving, plucking, or waxing, which are all safe for pregnancy. Professional options are not researched for safety during pregnancy and should be avoided. Growing a baby is an amazing feat, but it doesn't come without changes or questions. There should be no questions or subjects that are off limits when you are pregnant or postpartum. Don't be ashamed to ask. Many people are experiencing the same thing as you or have the same questions. For more information on sex during pregnancy, please see our video on this. We will link it in the description below. For more information on breastfeeding, please check out our breastfeeding and lactation playlist. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional information. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.